Knee pain that comes and goes during the day is actually very common for people. Some of the examples that people may describe: stiffness in the morning, then they feel better when they're moving, then the discomfort builds back up later, and then the pain settles again after rest. A bit of a yo-yo effect. This change in pattern can feel quite confusing, but it doesn't always mean that something is damaged. Often, it reflects how the knee responds to activity, load, and fatigue. So let's talk about why symptoms fluctuate. The knee constantly responds to load, movement, fatigue, and activity patterns. As those four things and others change, symptoms may increase or settle. Busy periods will increase the demand on the knee. Rest periods allow symptoms to calm. Repeated activity builds fatigue. That's why the pain can come and go, and we get that confusing sort of thoughts. So how do daily routines affect the knee? So for example, work patterns often explain symptom changes. Different jobs place different demands on the knees. Standing, walking, lifting, kneeling, sitting for long periods. Understanding your daily pattern usually explains why your symptoms may fluctuate. Physical or manual work, whether it's repeated movements, can build fatigue as well. For example, bending, squatting, lifting, kneeling. And as that fatigue builds, the knee may feel more sore. Once work finishes, you go home and you rest, symptoms may often settle again. And it sounds good, but it's annoying to still get that fluctuation. So people who stand or walk all day at work, or just in general, can lead to dull aches in the knee, stiffness, or just that heaviness feeling in the knee. This often appears later in the day, and rest usually improves the symptoms. So desk-based work. People who sit for long periods create a different pattern compared to others that I just described. When standing up, the knee may feel stiff, the first few steps may feel uncomfortable, which is very common, and the stairs, if you go up and down, might feel harder initially. But once you start to move, the symptoms often improve. So movement can help and aggravate your knees at the same time. So gentle movement helps by reducing stiffness, increasing circulation, but repeated activity without recovery builds fatigue. That fatigue can bring symptoms back later on. So simple ways to help. You can change positions regularly. You can stand and walk briefly. Take short breaks when you need them, and you can alternate tasks if possible. You can try and spread the activity more evenly throughout the day if it allows it. Avoid sudden spikes in activity, pace busy days, and space the heavier tasks out. Recovery is also important because when symptoms fluctuate, you need to get that recovery in. So we need to allow rest. We need gentle movement throughout busy periods. And if you knees feel irritated, try cold therapy for 10 to 15 minutes or however long you prefer after a busy day. This may help calm that irritation. Of course, if your knees are really bad, please get professional advice. And some symptoms, if it's persistent, swelling, it worsens, you've got lock-in, feels unstable, go and see a physio, okay? But to summarize this video, knee pain that comes and goes is actually very common, and it's often linked to activity patterns, fatigue, and repeated movement. With better movement variety, load management, and recovery, symptoms can often become more manageable for people.